Why sitting at a desk all day could be behind your pelvic pain. Suggested delivery, measured and calm. This is Alex's video, so the tone needs to feel like a knowledgeable friend explaining something clearly, not a clinician delivering a lecture. Speak directly to one person. Allow small pauses between key points. Avoid clinical jargon without explaining it. Approximate length at a natural conversational pace, 2.5 to 3 minutes. If you've been dealing with pelvic pain, a burning sensation in the perineum, or that strange feeling of needing to urinate when you just went, and you spend the majority of your working day sitting at a desk, this video is worth watching in full. Because there's a direct clinical connection between prolonged sitting and a condition called chronic pelvic pain syndrome, and it affects far more men in desk-based jobs than most people realize. Let me explain what's actually happening. The pelvic floor is a group of muscles running from your pubic bone to your tailbone. They support the bladder, bowel, and prostate, and they play a significant role in sexual function and sensation. These muscles are designed to move between tension and relaxation throughout the day. When you sit for several hours, particularly in the slightly forward-leaning posture that comes with screen work, your body weight compresses the soft tissue between your sit bones. That's sustained, low-grade pressure on the pelvic floor muscles and the nerves running through them. Over time, those muscles respond by tightening and staying tight. They develop what are called trigger points, areas of persistent tension that refer pain to surrounding areas. That's why pelvic pain can show up in your lower back, your perineum, your scrotum, or even the tip of your penis, without any obvious injury or infection. Now add stress into the picture, and if you work in a high-pressure environment, it's probably already there. Psychological stress directly increases muscle tension throughout the body, including the pelvic floor. So what you end up with is sustained compression from sitting, plus chronic muscle overactivity driven by stress, both pushing in the same direction at the same time. The result is chronic pelvic pain syndrome, or CPPS. It's not rare. It affects between 2 and 10% of men, and it's particularly common in men between their 20s and 50s. Here's the part that frustrates a lot of the men we see. Most of them have already seen a doctor. Tests have come back clear. No infection, no obvious cause. Some have been prescribed antibiotics that haven't helped because CPPS isn't bacterial. Some have been told to do pelvic floor exercise, and that one is worth addressing directly because for CPPS specifically, exercises that strengthen and contract the pelvic floor can actually make things worse. The problem in CPPS is almost always too much tension, not too little. The right approach goes in the opposite direction, release, not activation. What proper assessment actually looks like is a 90-minute clinical conversation, not a 5-minute appointment, not a test and a prescription. A full review of your symptoms, when they're worse and when they're better, your posture and movement habits, your stress levels, any previous treatment you've had, and a physical assessment of the pelvic floor and surrounding muscles. From there, treatment is built around your specific pattern, not a one-size approach. For most men, that means pelvic floor rehabilitation focused on releasing overactive muscles, combined in many cases with focused shockwave therapy to address deeper tissue tension and inflammation, and alongside that, practical changes to how you sit, how often you move, and how you manage the nervous system's contribution to all of this. The evidence is reasonably encouraging. Research shows 50 to 70% of men see meaningful symptom reduction with specialist pelvic floor therapy when it's done correctly. If any of what I've described matches what you've been experiencing, particularly that pattern of symptoms that worsen with sitting and ease with movement, the most useful next step is a free, confidential discovery call. No commitment, no pressure, just an honest conversation about what's happening and whether specialist assessment makes sense for you. The link is below.